GDP ratio decreased from 103% in June 2016 to about 80% of the GDP in June 2020. Still, it started to rise again, driven by the high inflation and rising interest rates, reaching 95.7% in June 2023.
And for more news, the Ministry of Health and Population have announced that some 12.3 million Egyptians have been examined since the launch of the Early Detection and Treatment of Chronic Diseases and Nephropathy Presidential Initiative. It was launched in September 2021 with 3,601 primary care units nationwide. The initiative provides early diagnosis and treatment free of charge for chronic diseases and high-quality health services to all citizens over 40 years old. Also, this comes in addition to the young individuals aged 18 and above with a history of chronic illness. And now we're delighted to be joined over the telephone by our guest for this afternoon to be telling us much more about this, Dr. Islam Anan, Lecturer of Health Policy and Health Economics from Ain Shams University. Dr. Islam, good afternoon to you, sir.
Afternoon. Happy to be with you.
Thank you very much for joining us. Doctor, let me start by asking you about the importance of this initiative in terms of providing an early diagnosis as well as, of course, free treatment of many chronic diseases, as well as the provision of high-quality health services for many citizens around the nation.
So, as you mentioned in the introduction, it's very important to have the philosophy of the early detection itself.
Yes.
So we have two pathways. Either we do the early detection and we can discover these diseases and illnesses, as you mentioned, for hypertension, diabetes, and kidney diseases,
yes,
up front and very early to be treating in an easy way, or to just leave it without screening and we'll be actually discovering all these patients in a late stage. So as you mentioned, 3,600 primary care units is actually a huge number. And so far, since the launch, examining 12 million and 5,000 citizens, it's a huge number, and it's one of the world records actually in screening non-communicable diseases, especially that you are measuring blood pressure, blood sugar, the random and the cumulative, the lipid profile, even the body mass index for obesity and overweight. So this is very important because once a medical case is discovered, whether there's a health disease like hypertension, diabetes, they will be referred to the tertiary unit and treated for free. And even it's worth mentioning that this treatment as a free of charge will be much, much, much less if we left the case to be actually diagnosed in a later stage. And even for that, the Ministry of Health provided guidelines for chronic diseases, and it is in collaboration between the Ministry of Health and the World Health Organization. And if the patient, for example, is suffering from any chronic illness, he will be moved to the specialized hospital, and even if there is an intervention like a cardiosurgical intervention, for example, would be added to the waiting list. And we are celebrating that in the waiting lists, we do have actually a fastest turnaround time. Patient can just wait for 2 weeks or 4 weeks to get his cardiosurgery done. Noting, of course, that there's huge training behind all these settings. There's huge training to the medical staff for screening, and as well for the treatment and referral system through the digitalized system already initiated by the Ministry of Health to all the primary care units and the tertiary units. Worth mentioning, because you mentioned, of course, the return on investment or why we are doing the screening.
yes,
The WHO released a very nice study that for non-communicable diseases, if we screened 60 million individuals and we identified, for example, 12 million cases for hypertension, we can decrease the mortality by 33%. We can enhance the economy productivity by $700 million every year, $1,000, which is equivalent to almost 0.3% of our GDP. Also, the same goes for diabetes. If we can discover 3 million subjects with diabetes, we're talking about a savings for productivity of almost $900 million US. So every time we are spending money in screening, we are returning to the economy $2.5. Every dollar spent returns $2.5 because we really detect these cases and we are not leaving them till late diagnosis and late management. Worth mentioning as well, it will be connected to all the other presidential initiatives working, for example, for dialysis, working for waiting list elimination, which was launched, and currently having 2 million Egyptian citizens on their intervention during the waiting list presidential initiative.
Absolutely. Dr. Islam, let me ask you, to what extent do you see the healthcare, being a vital sector that has really witnessed a noticeable improvement over the last few years? As you mentioned, the figures even extend to the Egyptian economy itself, the early detection and early treatment of chronic illnesses. How do you see the advantages of this, in your opinion, doctor?
Yes, I can see that 2018 was a turning point to the healthcare system. We moved from just focusing on the system and the patients to focusing on the citizen health and the early detection. Focusing on that is one of Egypt's pillars in 2030 vision for health, to be a citizen-centric healthcare system, where we early detect the diseases, we prevent the disease from happening. Hence, we do have the obesity presidential initiative to be launched soon, the stunting presidential initiative, the short-stage anemia and anemia, for example, which is precursors to a lot of diseases that can happen in the future for these individuals. If we look at the presidential initiatives for health, we're looking at all the citizens from newborn. We do have presidential initiatives for newborn, even for pregnant mothers, till youth and school age, where we are tackling the stunting, obesity, and anemia, and then even taking the non-communicable diseases like the one we are mentioning now for hypertension and diabetes, till we reach the senior citizen and mental health, for example. So taking all the life journey of the Egyptian citizen is a huge reform happening in the healthcare system, and it is reflected actually when you look at the launch of the new healthcare system insurance, which is currently launched in 5 governorates. And when you look at even the budget, from a budget perspective, you can say that from budget, if we look 10 years ago, it was around 35 billion Egyptian pounds. We're looking now of a budget of 147 billion Egyptian pounds is actually injected in the healthcare system. And we can see the impact of that mainly in the surgical interventions, in the services done to the citizens and the universal insurance, where they can get all their treatment for free. And we are aiming by 2030 and 2032 to have all Egyptians covered by the new insurance and to decrease the out-of-pocket expenditure to be like 20% instead of having it on a 60% basis.
Indeed. Dr. Islam, you mentioned a very important issue, leading me, of course, to my next question, which is the comprehensive health insurance system. Could you tell us a bit about some of the developments with regards to the implementation of the system, the next steps and the time frame, what is expected in this regard? Of course, we've seen President Sisi giving directives to continue the stages of implementing the health insurance system in order to reach the desired goal of covering eventually all the governorates, offering health coverage to all Egyptians all around the country.
So as our president mentioned many times, we are looking at the social solidarity of Egyptian citizens. We don't want any Egyptian citizen to be paying from his pocket 12 or 25% share on his treatment or medications, which is the current expenditure.
Yes.
We would like and aim to have it to the minimal, so we have all of them on a public fund. And since the launch of the universal insurance, the plan is to take it governorate after governorate, where we are replacing the old system of the health insurance and the own state fund system. We replaced by one system, treat all the family and having a general practitioner responsible for the family itself, and then where any intervention needed to be referred to the tertiary care. So far, 5 governorates were actually covered by the new insurance system, successfully covered. The funding system is completely different from the establishing of the Universal Health Insurance Authority, which is an authority responsible for the funds and for the continuity. And the most important term here, financial sustainability of the health insurance itself. And every year we should include governorate in the plan till we reach the 100% of the governorate, which will end by Cairo, which will be launched by 2030 to be finished by 2032. So by 2032, all Egyptians will be covered by a new system. And it's very important to mention to all citizens that the treatment itself even will be through private hospitals and public hospitals.
Yes, actually, indeed,
yeah,
Doctor, obviously, this was my next question. The collaboration, we've seen the President directing officials to enhance the private sector's role in the implementation of the universal health insurance system. Tell me a bit more about how the private sector is going to be helping out to swiftly carry out the National Health Project in Egypt.
It is very important. It's very important. No country can actually serve 100% through the public sector. Even in the Western countries, Canada and Europe, you need the collaboration of the private sector. Hence, the public-private partnership was launched, and it provokes and actually encourages competition between the public hospitals and the private hospital, where the citizen will be having the freedom to go to a public hospital or a private hospital. So we are enhancing the quality, and it's very important that we do have now the Gahar Authority, which is responsible for the accreditation and for quality, to make sure that we do have an equal measurement of quality between all hospitals. So currently in the 5 governorates, for example, we do have public hospitals accredited from the Gahar Authority, so they provide same quality exactly like the private institutions. And in terms of pricing as well, I'm putting the same ruler and the same measurement in terms of pricing. So public-private partnership is very important in terms of coverage, so I can reach all the rural areas, all the urban areas. It's very important from competition, so I have for sure every time a competition between the hospitals to attract the citizens and to attract beneficiaries from the insurance itself. So year after year, you will see enhancement in the public sector to keep up with the private sector as well. And most important is I'm controlling as well the private sector to be controlled under the Gahar Authority quality, which is again very important to have equity. The main aim of the healthcare system and our vision in 2030 for health in Egypt is equity and solidarity. Both can be achieved only if we do have a competent collaboration between the public sector and the private sector.
Absolutely, Doctor. Let me ask you, Doctor, now, of course, we're seeing lots of other initiatives, and one that you also mentioned, which is to, decrease the number of people on waiting lists to get their surgeries done and to get the medical support that they need. President Sisi has also instructed the Tahya Masra Fund to allocate £1 billion Egyptian pounds to support this presidential initiative to end waiting lists for critical cases. How important do you see this initiative, and how far has it come along in, saving the lives of many people who've been waiting for medical attention?
The part that waiting list is a big burden on all the countries. To give an example, currently in UK, we do have 2 million British citizens on the waiting list waiting for surgical operations. We do have 1 million citizens in Germany waiting for surgical operations and so on. So the launch by President Sisi of the waiting list elimination prevention initiative was very important to decrease 2 things: decrease the number of patients on waiting list doing surgical intervention, and second one is to decrease the turnaround time, the time from needing the intervention till operating and finishing the intervention itself.
Right.
So far, we are talking about 2 million citizens have done their surgery from the waiting list elimination program. And from time perspective, I can say it was very successful because we are talking from 1 day for critical surgeries. Imagine it's 1 day from the submission of file to the surgery itself, sometimes 2 weeks or maximum 1 month. So currently, we do have on our waiting list around 50,000 Egyptians on the waiting list, which is a great achievement, was recognized by all the international organizations because we exceeded the waiting list happening in Europe currently. And I believe one of the most important to achieve that is to have a good digitalization system and platforms that can easily shuffle the patients between hospitals. Even when you go through the initiative itself, you will find that they launched satisfaction surveys even for patients. They can even move from hospital to another hospital if they don't like it, if it's far from their home. They write a satisfaction survey about the operations, about their feedback, what can be enhanced. I believe this is one of the most successful presidential initiatives, and it's very important to continue so we can eliminate. And when we say eliminate, it's not zero waiting list, but eliminate, it means that we are reaching the target of our waiting list on the list itself and within the time frame that we are committed to, which is much less from the international standards.
Absolutely. Right. Finally, Dr. Islam, now, as implementation is ongoing, what do you see are some of the next steps that are needed, in the overall health insurance and medical care system to work on ensuring social health for the Egyptians and their protection, in particular with the economic challenges, of course, that the country and the whole world is facing?
I return again to the same terminology, financial sustainability. This is the key word now. And to ensure that the healthcare system and the President Sisi office launched a lot of initiatives to ensure that. One of that is to have the health insurance like on the base of like the private insurance. We are collecting premiums from the families, from the tax to we have fund that can ensure financial sustainability. That happened with the new insurance system. So you will find in the 5 government rates, the fund is sustainable. They do have surplus of fund they can actually sustain till the end of the insurance itself. Another one is moving, as I was saying, from patient centricity model to citizen centricity model, where we do have a primary prevention. We are preventing disease, not just treating. It will be much cost beneficial. And as I was telling you, preventing disease, every time you are spending on prevention $1, you are saving from curative $7. So it's a very good strategy in terms of healthcare solidarity as well. You are decreasing the burden on the tertiary healthcare, on the tertiary hospitals, by discovering the cases on the late stage. To give you one example, in breast cancer, for example, because of successful Women Health Initiative, currently the metastatic cases, which is the terminal cases of breast cancer, decreased from 60% to 40%. So every Egyptian pound was spent on the breast cancer initiative returned again to the economy as 1.5 Egyptian pounds, because you are discovering the cases on an early state. You don't need to wait, and then you are engaged in a surgery, engaged in a lot of metastatic condition management, which costs millions and millions of dollars.
Absolutely, absolutely. I'd like to thank you very, very much, Dr. Islam Anan, Lecturer of Health Policy and Health Economics in Shams University. Thank you very much, sir, for your insight and for your comprehensive insight and joining us this afternoon on Cairo Local Time. Ladies and gentlemen, a short break and we'll be back to continue the edition of the show. Do stay tuned.